Welcome, Apollo Health practitioners. I'm Liz Lundry, a hygienist and the clinical educator for StellaLife, and we have partnered with Apollo Health so together we can help our patients improve brain health by optimizing oral health. Our mission, like yours, is to improve lives, and we invite you to join the thousands of healthcare providers helping hundreds of thousands of patients to use StellaLife and accelerate healing while we're removing pain. We are also able to help to develop a healthy oral microbiome by targeting these common but deadly periopathogens. So today I'm going to be going over the science behind StellaLife and the applications of StellaLife oral care products, how to incorporate these into your practice. And I'll also be sharing information about our StellaLife pre and probiotic lozenges. Putting these together can also really elevate your practice. So we are aware of the consequences of having the presence of P. gingivalis and F. nucleatum in our bodies and our mouths. And if you're doing salivary diagnostics, you will probably have seen that most patients do have some of these above threshold. So StellaLife Oral Care line is great for managing these pathogens and also to develop a balanced oral microbiome. So, with over 18 years of research and nearly a decade in usage, we have seen great results. And the rinses that are available come in a mint, peppermint, and spearmint flavor, as well as a coconut flavor. All the rinses are great to use as a safe disinfectant without any staining, any burning, no toxicity, and no side effects. And the rinses also taste really good, like all Stella Life products. The peppermint and the spearmint rinse have similar active ingredients, and all of these rinses can be used not only for safe disinfection, but also for hydration for patients that have xerostomia. They also help provide relief for the symptoms of lichen planus, any type of oral mucositis, Sjögren's, many multiple applications there. So again, the spearmint and the peppermint have similar active ingredients. Our coconut rinse has twice as many protective ingredients. All of these are very healing for the mucositis and other common oral conditions I mentioned, but the coconut rinse has a creamier consistency and is more hydrating for your patients as compared to the mint. The coconut rinse also was developed in response to those patients that have burning mouth or sensitive mouths and can't tolerate mint. So the coconut rinse also has more healing properties. So it's in a class of its own, but again, all three rinses have great applications with your Apollo Health protocol. With the gel can be applied to any lesion. The gel will provide analgesia within 2 to 3 minutes that lasts up to 3 hours for any painful lesions or aphthous ulcers or any other common oral conditions that we see. With the rinses and the gel, they all accelerate healing. I'm going to share that research with you so that we can help our patients with these common oral conditions heal very quickly and remain stable. The recovery kit has a full-size peppermint rinse and a gel, as well as a sublingual spray, which is unflavored. This is a wonderful package that has great benefits for those patients that have more severe mucositis. The sublingual spray that is in the recovery kit box provides ingredients that enter the bloodstream through the blood vessels under the tongue, providing you systemic reduction of inflammation, as well as providing really great analgesia for our patients. So these three together work synergistically to safely disinfect the mouth, providing hydration, accelerating healing of any type of mucositis, and also providing pain relief for your patients. Our StellaLife oral pre and probiotic lozenges are great for establishing a healthy oral balanced microbiome, which will not allow a place available for the pathogens to take hold and proliferate. So altogether, we're able to safely disinfect without any side effects and then reestablish and continue to maintain a healthy oral microbiome by continuing use of our StellaLife rinses and oral probiotics. These products are considered safe for everybody to use. There are no contraindications with any medications. The only contraindications would be is if somebody is allergic to any of the ingredients, and all the ingredients are listed on the packaging. So, with the category under which the FDA has filed StellaLife Oral Care, we have to state that if the patient is younger than 6 years of age, or if they are pregnant or lactating, then the products need to be used under the care of a healthcare provider, which would be the pediatrician or the OBGYN, if there are any concerns with those patients. With our package here, we have many different applications and benefits. We're able again to disinfect safely without toxicity. We can use this in any aspect of our oral systemic practice care, as well as for myofunctional therapy. Again, great for xerostomia and any types of oral inflammatory conditions, and providing comfort for patients that do get aphthous ulcers and herpes simplex lesions, really helpful for those, and assisting those patients that do have dentures or have had implants with fixed dentures on those, keep those areas healthy and clean, again, to reduce the pathogens that would be harming our patients. This study done at Rutgers looked at the bacteriostatic activity of StellaLife rinse and found that after exposure, FN and P. gingivalis do remain inactivated for a number of hours. With FN, after exposure to StellaLife rinse, the bacteriostatic activity was maintained for 12 hours. With a P. gingivalis, we're seeing that StellaLife is bacteriostatic for 120 hours after treatment. This study also showed that there was a lower toxicity toward those commensal bacteria, which we really need to maintain again to create that balanced oral microbiome, which is also, of course, connected to the gut microbiome. This also compared in the study the StellaLife rinse to Listerine and chlorhexidine, which definitely are quite toxic to the commensals. But the good news is that the StellaLife was as effective as Listerine and chlorhexidine in reducing the pathogens and showed great biofilm disrupting activity. The other pathogens against which StellaLife rinse is effective include strep mutans and the bacteria that causes tooth decay. So this is great as our patients with xerostomia tend to have a higher caries risk. So with one product, they can hydrate and reduce their caries risk with any of the StellaLife rinses. With the presence of these commensals, we're able to have nitric oxide gas produced. However, when we use the chemicals that all of us have been using in dentistry and definitely in medicine for so many years, we find there's so much toxicity toward these commensals. So in this study, they compared the StellaLife rinse to chlorhexidine and to oxystone, which is a peroxide-based rinse. And when the mouth was exposed to these other chemicals, with using a nice nitric oxide test strip, it was found that there was no nitric oxide being produced. Again, this is one of the very important functions of the commensals that live on the dorsum of the tongue. So, as you know, without the nitric oxide being produced, the blood vessels become constricted and it causes patients' blood pressures to go up. And it also increases their heart attack risk. So with the StellaLife rinse, there was plenty of nitric oxide being produced. So again, we need to respect the commensals because they are so important to our health. Again, this is an emerging field. We're learning more and more about what these incredible bacteria do for us. As far as the healing benefits of StellaLife, there are a number of university studies, which you can see all of the research I'm presenting and case studies on StellaLife.com. If you go to the professionals tab and then click on the research tab, you can look at these studies in depth. So one of the studies, as some of the others, looked at fibroblast growth. When we look at StellaLife compared to, in this study, chlorhexidine, Listerine, and saline, it was found that the StellaLife rinse not only was not toxic toward the fibroblasts, but actually increased the growth of the fibroblasts. So with that increased fibroblast growth, you have increased accelerated collagen formation, and this is why we have accelerated healing with any type of oral lesions that our patients may experience. So when you look at the samples from the scratch wound assay here, you can see how many fibroblasts are replicating with a StellaLife sample and how there are no fibroblasts at all with a chlorhexidine sample. And similar results are found with the Listerine as well with the saline. And here is the control where you can see normal fibroblast activity, but you can see how many more are proliferating with the StellaLife rinse. So here's a patient that had pemphigus vulgaris and was actually put on the program using the recovery kit, the StellaLife recovery kit with the three products, the rinse, sublingual spray, and the gel. That is a protocol where the three products are used 3 times a day for a total of 10 days. And in this case, they needed to have the patient use 3 recovery kits. So she was using the recovery kits for 1 month before the clinicians were happy with the resolution that she experienced. And the patient continued to use the rinse and gel for an ongoing basis as this is a chronic condition. And you can see after 3 years of using the rinse and gel as needed, everything looked very healthy, very normal. And again, this is life-changing for these patients since they have to avoid so many foods. They have chronic pain. And when they try to brush their teeth, it's extremely uncomfortable. So for this, as well as any other type of mucositis, we have seen great benefits with the use of StellaLife. And again, with these chronic conditions that are often linked with autoimmune disorders, using that recovery kit really makes a difference because that sublingual spray reduces inflammation on a systemic level. And we look at this lichen planus patient, she had been using steroids, which did not help her at all. And as you know, there are many side effects from steroids that we really need to avoid. So she was given the rinse and the gel, and after 1 week, got great resolution, reduction of the lesions, as well as no more sensitivity. So for this patient, the rinse and the gel worked really well. Again, for some patients with long-term, well-established lichen planus or other types of mucositis, the recovery kit would be the best way to go initially. Have them use the recovery kit for the 10 days till they finish all of the ingredients. Have them come in to take a look at the tissue to see if they're feeling better and how the tissue looks. If you're not happy with the resolution, then they should do another round of the recovery kit. Same protocol as was used for the pemphigus patient I just showed you. And then after you're happy with the resolution, the patient feels comfortable, they will go on any of the StellaLife rinses that suit them and use the gel as needed. You would use the same protocol for any type of mucositis, Sjögren's, and also any of your patients that may be going through cancer therapy. So our oncology patients, as they are about to begin chemo or radiation of the head or neck, they can use the recovery kit starting 3 days before they start their treatment. They will continue to use the same protocol the day of the treatment, using all three products 3 times that day and for 7 days after. And then they can just go on to using one of the rinses through their treatment and have the gel on hand in case they get any lesions. But by using this protocol, The reports we're getting from our oncology patients is they are not getting the lesions they would normally expect with their treatment, as well as continuing to be able to swallow. With a lot of these treatments, which include radiation to the face and to the neck area, it gets very painful for them to swallow. If they stop doing that, the body forgets how to do it. It's very difficult to get that reflex to come back. So we can really mitigate that by using StellaLife before they start their treatment and as they go through that treatment. So with the recovery kit, again, these are three products that are used 3 times a day. They would start using these products again if with any type of oral mucositis that is too severe for the rinse or the rinse and gel to help. So again, the sublingual spray is the key as it has 12 active ingredients, same active ingredients as are in the gel, but it works systemically, again, to reduce inflammation. It also reduces any pain, so it provides analgesia for those patients and it really accelerates the healing together with the gel, which is applied topically. So when the recovery kit is used, they use the rinse, they swish for 1 minute, and then they spit out. After that, they put 4 sprays of the oral spray right under the tongue, and that will get those ingredients into the bloodstream. And then they would apply the gel to their lesions. So that may be the full mouth, dependent on what condition the patient has. So with these products, I just want to go over the use of the rinse itself. These products are pretty much all natural. The active ingredients are derived from plants and minerals. So they do need to be shaken every time the rinse is used. One of the ingredients is propolis, which comes from beehives. It is a wonderful antifungal and it's very soothing, helping with the healing as well. So it does tend to sink to the bottom of the bottle because it is a heavy resin. So we need to shake the bottle and that'll blend all of the ingredients so you get the full benefits of using the rinse. Each of the rinses comes with a little measuring cup. The patient only needs to use 10 milliliters and they can rinse for a minimum of 1 minute. And it does feel really great if they have any type of soreness in their mouth, so they can rinse as long as they like. 2 minute rinse works really great. So they would rinse, spit out, and then wait for 20 minutes before eating and drinking. And it's important to do that whether you're using one, two, or any combination of StellaLife oral care products. So on the bottle of the rinse, it says 1.8% alcohol. We do not add any alcohol to the rinse. The alcohol is used to extract the essential oils from the plants. Also, once the bottle is opened and some oxygen gets in there, the propolis begins interacting with the other ingredients. So that produces a minute amount of alcohol. But when the cap is removed, the alcohol dissipates as a gas. So there are no issues with alcohol. We don't want to use alcohol-based rinses because it does dry the mouth more. And I'm sure it's not healthy for those commensal bacteria. So we do not want to use any alcohol. We don't have that in our rinse. So with that, all of our products have up to a 2-year shelf life. Once the rinse, the other products are open, they ideally should be used within 60 days. It doesn't expire on day 61, but if somebody puts the rinse in their medicine cabinet, forgets about it for a few months, then it will ferment. So it'll go off. So again, should be used in a timely manner. If you are dispensing the rinse for xerostomia, for example, if a patient is using the rinse twice a day, there are 47 applications in one bottle, so they'll need a bottle and a half to get through a month. So depending on the usage, that's what you can expect from one bottle. With the sublingual spray, again, they will put 4 sprays of this under the tongue and then apply the gel with a swab to all the tissues of the oral cavity or any lesions that they may have. So the recovery kit, as well as the gel, are eligible for HSA and FSA benefits. If your patient has a flex plan at work, then they can use those funds for their StellaLife recovery kit or the gel. Our oral pre and probiotic lozenges have really been a game changer as we have 11 select strains here, and we're able to really promote a healthy oral microbiome. Again, preserving those commensals. And once we have a good population of the commensal bacteria, the pathogenic bacteria just don't have a parking spot, so they can't take hold and proliferate. So we are the only company that has all of these species. These have been carefully selected to reduce P. gingivalis activity as well as FN and strep mutans and other bacteria. Again, we're able to also help patients with their digestion and other issues when these strains are used. So the lozenges are, again, a very pleasant, delicious strawberry flavor. They just allow the lozenge to dissolve. It takes up to 5 minutes. And after using the oral lozenge, they shouldn't eat or drink anything for 20 minutes. And they also should not use any antiseptic mouthwash, including StellaLife, for 2 hours before or 2 hours after the use of the oral probiotics. So again, in summary, when you use our StellaLife rinse, we're able to safely disinfect the mouth, getting rid of the pathogens, but not killing the good, nice, healthy commensal bacteria, which do so much for our health, including producing nitric oxide gas to keep our blood vessels dilated. So we're able to establish this nice, healthy, balanced oral microbiome, which of course is going to affect the microbiome of the brain. And we can provide relief for patients that have any type of mucositis, get any type of mouth sores, angular cheilitis, for example, with the gel. We're able to really help these patients be comfortable, as they're fighting their disease. And our products are natural, non-toxic, and they do taste great. So we want to help your business as well. So as a StellaLife provider, if you're dispensing StellaLife from your practice, then we actually will put you on our website as a provider. There are patients who are looking for providers of StellaLife in their area. We provide an app which you would normally pay for called Intellibly and Schedule Widget. And when you link that to your StellaLife account as a provider, you will have this tab under your listing. And when patients click on that, then you'll get their contact information and when they like to come in to see you. So we would like to help give you foot traffic and send you new patients as well. So with our products, we have a guarantee. As a provider, you always get 30% off when you order in bulk, which means ordering by the case. All StellaLife products come in cases of 12. And the guarantee is this. If you purchase any StellaLife product, a case of any of these products, and you decide it's not for you, we will buy it back from you. No questions asked. If you dispense a product to a patient and they don't like it for whatever reason, then please give them a refund and we'll replace the product for you. And if you have product that expires, we'll replace that for you too. We don't want you to fear having these products so you can really help your patients and help them in their recovery with your recode protocol and also the preventative aspects of using StellaLife rinse every day in your pre-code protocols as well. So we're here to help. Please contact us so we can answer your questions and help you get started with StellaLife. Thank you so much for your time. And here I'm just going to share some of the research that we have for you. Thank you again for all you do for all of your wonderful patients.